Doctor, I've got a lump in the neck. Is it cancer? Now, one of the most common concerns of patients who present with a lump in the neck is, could this be cancer? And one of the most common cancers is called a lymphoma. Now, a lymphoma can present with what we call a persistent lymph node, which is what they describe as a lump in the neck, and it can appear in any of these areas. You can also have lymph nodes in other areas such as the armpit and the groin and lower abdominal area. So what we mean by persistent is a lymph node that has been going on for more than 6 weeks and can usually present with other symptoms such as fever, night sweats, weight loss, and feeling itchy all over the body. You can also feel very tired, or what we call fatigue, as another symptom of lymphoma. However, you do not have to have these symptoms, and in most cases, a patient will present with just a lymph node in the neck. In most cases, your doctor might want to do some blood tests, such as a full blood count to check your white cell count and to check your viral count in the form of lymphocytes. However, be aware that a lot of lymphomas can present with a normal blood test, so do not always expect an abnormal white cell count of a lymphoma. Now, lymphoma is the 6th most common cancer in the UK, and usually diagnosis of a lymphoma can simply be done by biopsy of the lymph node as opposed to an ultrasound or doing blood tests. There are 2 kinds of lymphoma. You've got the non-Hodgkins lymphoma, and then you've got the Hodgkin's lymphoma. Now, the non-Hodgkin's lymphoma is the most common type because it represents 90% of all lymphomas, while the non-Hodgkin's represents 10% of all lymphomas. You find that 70% of all non-Hodgkin lymphomas present in those under the age of 60, and the usual causes can include viruses such as EBV, hepatitis C. You could also have bacterial infections such as Helicobacter, which is a bacterial infection of the stomach that can also trigger a lymphoma. There are also 2 types of non-Hodgkin's lymphoma. You've got the large B cell, which is the aggressive type and is actually curable by chemoradiotherapy in 80% of cases. You've also got the low-grade non-Hodgkin's lymphoma, which is actually more of a watch and wait approach because there is no cure for this type of lymphoma. So, doctor, I've got a lump in the neck, could it be cancer? So just be aware of what we call a persistent lymph node. So any lump that presents for more than 6 weeks, and you might have any other associated symptoms such as night sweats, weight loss, loss of appetite, fatigue, or just feeling generally itchy over the body. If you have any of these symptoms, please see your doctor.